Hey docs, I want to stick with a subject that's sort of near and dear for me as I serve as a mentor to all of you, and that is really like the focus on becoming a super GP. And one of the things that I wholeheartedly believe in is that you can really make your practice and your career where you can become more or less a one-stop shop for patients, and you can do treatment on the level of anybody out there, including the specialists. And so cases that right now might be overwhelming and daunting and crazy sounding and seem like something like immediate referral, we've all been there because we've been through those times where, we struggled to decide even where to start with a case. And so one of the things that I really believe is that you have to always have a 2-year continuing education plan, and you want to map that out so you know where you're going with your career and you can start to chip away at it. It may not be an all at once kind of thing, but over time you can really create the roadmap to knowing right where you're going with your career so that you can start knocking out the things like sedation, cosmetics, ortho, Invisalign, dentures, implants, endo, all the stuff that's more or less like super GP level. And really, to me, a super GP means that you're a well-rounded dentist that can do most of the cases that come your way, and you really can treat most things. You have the ability certainly still to refer, but the idea is that you're not having to, because the truth is patients don't want that. And so there's two sides of this. One is having a plan and starting to work your way towards it on the educational continuum in your career. The other part, though, is to actually have, identify those cases where you get hung up, where you're challenged, where you're not sure where to start, and start putting them out to the doctor group. Or bring them to our study club in November, and let's start chipping away at your knowledge base so you know where to start, what to do, how to present. It's not only the clinical skills, it's the verbal skills. How do you present this? How do you get to the bottom of what to do? And all of those things really, really matter in your skill set. And so certainly the other piece of it is, between now and then, I'm always available to you. You can text me, call me, email me, FaceTime me. I don't care if a patient's in the chair, try to reach out to me and just know that I'm happy to help. Certainly you have other doctors that would step up and help you at any time. Dr. Kate has 18 years of experience, tons of Invisalign and ortho experience. Dr. Har's been doing this for 3 years, Dr. Mo 4 years, Dr. Urban 5 years. You've got great resources. Dr. Doan, I believe 7 years in his career, so you got some great resources around. You just know that we are all happy to help, and that each one of us collaborating and working together can make these things go. So any topic, anywhere, including the leadership stuff too, really is part of what makes you the super GP. So let's start planning it. Let's start working together on it. Let's make you guys the best people out there for patients to go see. Thanks, guys. Have a good one.